Good afternoon and welcome to the July 13th GMC membership meeting. I'm David Lubar, Chair of the GMC and President and CEO of Lubar & Company. I'd like to welcome today's special guests, Cavalier Johnson, President of the Common Council, and Theo Lipscomb, President and Executive Director of LISC Milwaukee. Today's meeting comes when many in Milwaukee are in a time of need, particularly those within communities of color. Today, we will hear how MKE United, a GMC program, is addressing serious racial inequities in our community, such as access to housing, healthcare, and capital, through two of its significant programs. That will then be followed by a panel of Milwaukee older people discussing these programs and their impact. To begin, however, I invite Dr. John Raymond, President and CEO of the Medical College of Wisconsin, to share a COVID-19 health update. As we all know, over the past month, Milwaukee and the state of Wisconsin have begun the phased reopening of our economy and businesses. Wisconsin and virtually every state in the country are experiencing surges in new cases, particularly involving younger people. Dr. Raymond, please give us an update on what's happening.
Thanks, David, and thank you for the introduction. Before I begin, I do want to start with a punchline, and that is that our early indicators of COVID-19 are actually very troubling, the worst that we've seen since mid-March, yet our lagging indicators still look good, and I'll explain that as we go through the slides. If I could go to the first data slide, please. This is about testing, and this slide shows that we've administered nearly 700,000 tests in Wisconsin as of yesterday, and all the data that I'll be talking about today were as of 2:30 yesterday afternoon. And of those 700,000 tests, we've done a little over 135,000 here in Milwaukee. Now, we've had almost 37,000 positive tests or COVID-19 cases in Wisconsin with a positivity rate of 6.0%. And unfortunately, that positivity rate, which also is an early indicator, is starting to trend upward. So that's not the right direction we want it to go. And in Milwaukee, we've had about 13,000 positive tests with a positivity rate of about 9.9%. And ideally, you'd like to see that positivity rate be under 5%, both in the state and here in the Milwaukee area. Now, yesterday, we had a relatively light day for reporting with 6,848 total tests reported. Our testing capacity continues to grow very significantly now, and we're up to over 24,000 test capacity per day in Wisconsin, and that continues to improve. Now we have 83 laboratories currently testing, with 24 others planning to test in the near future. Now, in terms of positive tests, the last 4 days are the highest 4 days that we've had during the pandemic, and that's not a good trend. So yesterday in Wisconsin, we had 769 positive tests with a positivity rate of 10.1%. And in Milwaukee, we had 267 positive tests with a positivity rate of 10.9% on average over the last 7 days. And again, it's important to note that the positive tests and the positivity rate are very early indicators. Now, our previous high for daily positive tests was just a few days ago, with 926 in Wisconsin on July 11th. If we could go to the next slide, please. Now, this slide shows some better numbers, and these are lagging indicators. So the total number of cumulative hospitalizations in Wisconsin since the beginning of the pandemic is now over 3,800, with a 10.5% likelihood of being hospitalized if you have a positive test. Now, the good news is the likelihood of being hospitalized continues to go down. Early in the pandemic, when we had very few tests available, we were hospitalizing about 30% of the positive cases. So with a broader availability of testing and better knowledge of how to take care of COVID-19 positive patients, our hospitalization rate is going down. Now, yesterday we had 264 inpatients in Wisconsin hospitals, and this is increasing by about 20 over the last week. Our high was 446, so we're nowhere near that high. And our low was 235 on July the 4th. Same trend in ICUs. We only have 74 in Wisconsin ICUs, but the trend is increasing. And our low was 65 on July the 5th. And I want everybody to understand that hospitalizations and ICU use are lagging indicators. And we would expect that that lag would be anywhere from 2 to 4 weeks from when we start to see a significant increase in the number of positive cases. And that's largely because it does take that long for COVID-19 increases to manifest with hospitalizations. But more importantly, as David mentioned, a lot of the new people that are getting COVID-19 are younger people. We may not see that increase in hospitalizations until later when there's a secondary infection from an older colleague, friend, or family member. Now, our ICU capacity is perfectly fine. We have 315 ICU beds available. That also is declining, so it's going in the wrong direction. Ventilator capacity is very copious, 969, and that is stable, so that's not a problem, likely not to be a problem for the next month. And our personal protective equipment trends are relatively stable with the most critical needs of goggles and gowns. And next slide, please. I'm going to talk about deaths. And deaths are probably the most important indicator, but they highly lag. So this increase that we're having in the number of positive tests, if it's going to show up as increasing deaths, may not be for another 4 to 6 weeks down the line. So cumulative deaths in Wisconsin thus far are at 820 with 359 in Milwaukee. And I have to say that the death trends are actually still declining. Nevertheless, we all know that the deaths have disproportionately affected people and communities of color. And you can see that by the statistics that I'm showing here. I'm not going to go through all of those, but it's important to note that we actually have an increase in the number of Latinx and Hispanic deaths and an increase in the percentage of Caucasian deaths as the pandemic spreads out from Milwaukee throughout the rest of the state. And so that's something that bears watching. Our doubling times for positive tests are pretty good, 33.5 days in Wisconsin and 39.8 days in Milwaukee. But I do want everybody to understand that these are actually trending in the wrong direction. The doubling times were a little larger in Wisconsin and in Milwaukee toward the end of last week. The daily growth rate is acceptable. It's 2.1% in Wisconsin and 1.7% in Milwaukee. But again, that percentage is based on a very large number of 38,000 positive tests in Wisconsin since the beginning. So even a small number or small percentage of growth is still significant growth. And probably the most troubling data that we can see here is our reproductive number. It's at 1.18 in Wisconsin and 1.33 in Milwaukee. And again, these are early indicators, but basically you want to see that under 1.0. What the reproductive number measures is the number of infections that a person with COVID-19 will pass along during the contagious part of their illness. So again, when the pandemic is slowing down, you want that to be under 1.0. Next slide. This next slide here shows 7-day average reproductive numbers since the beginning of the pandemic in mid-March. Can I have the next slide, please? And what you see here, beginning in mid-March, are these reproductive numbers, and these are 7-day averages, so they're smoothed out over the week. And in Milwaukee, that's shown in tan, and in Wisconsin in blue. And I want to draw your attention to the red arrow on the far right that showed an inflection point that began a 25-day run of reproductive numbers over 1.0, both for Milwaukee and for Wisconsin. And unfortunately, this run came after a very promising 16-day consecutive stretch when the reproductive number was less than 1. So at that point, there was clear evidence that we were having a deceleration of the pandemic in Wisconsin, but unfortunately, that trend has reversed and we're actually seeing an acceleration of the pandemic. Next slide, please. Now, the last time I presented to you, I said that we'd reached a tenuous equilibrium with COVID-19. And I encourage diligent use of the only tools that we had available to us, including physical distancing, hand and respiratory hygiene, and sanitization. And as of today, those tools remain the main tools that we have, and they're even more important. Next slide, please. Now, many have asked me, what can we do to mitigate the spread? And I'd like to reiterate the importance of the 3 W's. Wash your hands, wear a mask, and watch your distance, which means maintaining at least 6 feet between you and the people who don't live with you in your home. Now, this slide shows really good evidence from a recent meta-analysis that was published in The Lancet, and the reference is shown in the bottom right side of the slide. And basically what it shows is the risk of infection transmission drops from 13% at 1 foot to 3% by decreasing separation up to 1 meter, and then by 50% for each meter of increased distance. So again, this highlights the significant importance of maintaining or watching your distance. Next slide, please. Now, this next slide further illustrates that masking works as well. The left-hand panel is an infographic showing that masks are most effective when both you and those around you wear a face covering. Now, the top right-hand panel illustrates more findings from that Lancet paper that I showed you on the previous slide. All told, face coverings of any type reduce the risk from spreading COVID-19, but some face coverings are better than others. N95 respirators obviously are the best. Surgical masks, which are the paper masks that many people wear, are next best. But a multi-layer cloth mask and even a single-layer cloth mask provide some degree of protection both for the wearer and for those around them. So again, I want to emphasize that even a homemade single-layer cloth mask like you might make from a t-shirt reduces the risk of transmission. Now, additionally, there is some evidence that face shields also might offer some protection, similar in magnitude to face coverings, although there have been very few studies on face shields. Next slide, please. Now, on this last slide, I just want to say, as we see surges in cases and increasing positivity rates across the country and here in Wisconsin, we should note that those hospitalizations and ICU cases lag by 2 to 4 weeks, and that deaths may lag by even several more weeks. And despite the younger demographic age of our newer cases, it's imperative that we continue to practice diligent physical distancing, hand and respiratory hygiene, face coverings, and sanitization. At this point, those really are the best tools that we have to keep everyone safe and to prevent an overwhelming surge of cases and hospitalizations like they're beginning to see, unfortunately, in states that are 4 to 5 weeks ahead of us, like California and Arizona, Texas, and Florida. And with that, I'll turn it back over. Thank you, David.
Thank you, Dr. Raymond. I'd like to just say that I think your precautions are certainly well noted, and especially since we have the sobering numbers that are starting to reappear in our community across the state. Since our last meeting, the GMC's developed a racial equity resource list on our website in response to member requests and also information that members have shared with us. And we're dedicating our July board meeting to a discussion of the GMC's role in racial equity. And we need your help. In order to gauge where to start, we ask that each member complete a racial equity pulse check survey by Friday. The survey was sent in Thursday's newsletter and it'll be shared again this week. And actually, Melissa, can you share the survey link in the chat with all the members right now? Members can open the link and be able to complete the survey. But we really need your input. It'll only take 3 minutes. It'll greatly aid our board moving forward. From the programmatic side, the Commons virtual internship began a few weeks ago with 120 student interns. We want to thank all of you who supported a number of interns. The interns are working on a variety of innovative projects, including 2 who are charged with finding a solution for the technology gap by bringing accessible Wi-Fi into disinvested communities. And for what brings us here today, an update on Milwaukee United. Milwaukee United is a partnership with the Greater Milwaukee Committee, the Greater Milwaukee Foundation, City of Milwaukee, the Urban League, and LISC Milwaukee. This transformation coalition of community, business, and government leaders have committed to a shared vision and a plan for inclusive economic growth in Milwaukee's neighborhoods adjacent to the downtown. Milwaukee United's goal is to create opportunity in disinvested areas and overcome inequities in these neighborhoods, often brought on by a lack of capital flow. Milwaukee United's made much progress over the past year to tackle the issues of inequity, specifically through programs like the Anti-Displacement Fund of Brew City Match. Specifically, our impact shows in the results and leveraged investments in the downtown neighborhoods, including $238 million of private and public investments. But I don't want to give away all the good news. Today, we'll hear from the Milwaukee United Executive Committee members, Ellen Gilligan, President and CEO of the Greater Milwaukee Foundation, and Greg Wesley, Senior VP of the Medical College of Wisconsin, on the continued activity happening with the Milwaukee United Collaborative. We'll hear then exciting new updates about Brew City Match from Beth Heskovitz, the Commercial Revitalization Program Officer at LISC Milwaukee, followed by an additional insight into the Anti-Displacement Fund from the GMC's Tony Ponciera, Program Director of Milwaukee United. So welcome, Ellen and Greg.
Hey, Julia. As you've shared, Milwaukee United is working hard to expand inclusive and equitable economic growth in Milwaukee neighborhoods that are adjacent to downtown. Many of the neighborhoods surrounding our downtown have had a troubling history of disinvestment over many decades. And we have a dedicated and intentional geographic focus to allow us to target our efforts that are core to our ability to be successful. Basically, we want to work to strengthen the areas in close proximity to downtown where the market forces have been successfully creating prosperity and value, to spread that to both the north side and the south side of Milwaukee. Going back to the beginning of our efforts in 2015 through a development process that has been collaborative in our vision and in partnership with the community, we brought a renowned urban planner, Tony Griffin, on board, and we were able to map 6 transformative directions that we wanted to take Milwaukee United in. These are distinct areas of focus, which we believe can make our vision become a reality for our city. We've worked to establish a convening structure to support the implementation of this vision. The 2 programs you'll hear about today are only a portion of the work that we have been doing to advance economic inclusion and access to capital in Black and Brown communities in Milwaukee. One important piece to mention is the ongoing community engagement work that we've been doing with community organizers in these downtown neighborhoods, or these neighborhoods adjacent to downtown, I should say. The organizers have been crucial to giving us critical information that we need in order to be successful. And I'll let Ellen elaborate on that a little bit more. Ellen?
Thank you, Greg. As many of you know, the Greater Milwaukee Foundation made a generational commitment to advancing racial equity beginning in 2016. And I want to say that our partnership and leadership of Milwaukee United helps us advance that commitment. So we are honored to be a partner in this important effort. So aligning both goals and investments is critical to large-scale change in the field of community development. And as you'll hear about further from Beth and Tony, the 2 examples of Brew City Match and the Anti-Displacement Fund are critical to this long-term. Sorry, I'm not sure what's ringing here. I apologize. Excuse me. Sorry. So the Anti-Displacement Fund and the Brew City Match are critical, both strategic initiatives of Milwaukee United, but really further the goal of equitable development efforts in downtown Milwaukee. So we've been coordinating with several national organizations through the Shared Prosperity Partnership, Milwaukee through Milwaukee United, and through the relationship through the Greater Milwaukee Committee has been part of the Shared Prosperity Partnership, which is composed of the Kresge Foundation, Brookings Institute, the Urban Institute, and Living Cities. This collaboration convenes national thought leaders and local practitioners to support our work and help us build locally sustainable solutions. Both of these programs you'll hear about today, the Anti-Displacement Fund and Brew City Match, have been modeled in other places. Brew City Match in Detroit and the Anti-Displacement Fund in Atlanta. Next slide, please. The small business development and really the anti-displacement, which is at work here in these two strategies, are critically important. They were critically important before, but they are more important now than ever to both sustain the gains that we have made to support small businesses that are really at risk now, and to prevent long-term displacement of long-term residents in our community. So the Brew City Match program, which Beth will talk about, we wanted to build on the existing assets in and near downtown and the neighborhoods known and through the business improvement districts. There is organizational infrastructure in place and one that had core capabilities to successfully implement an effort such as this. We held a convening in 2017 to collaborate with local partners and brought speakers in from Detroit and worked together to develop a model of what success could look like here. From there, we submitted applications for collaborative funding for this effort, structured and led by the Local Initiative Support Corporation in partnership with the city's Department of City Development, the Hmong American Chamber, the Columbia Savings and Loan, MEDC, the Women's Business Initiative, otherwise known as WIBIC, and Milwaukee United. JP Morgan Chase, who has also supported the GMC's Spark program, helped seed the initial commitment to make Brew City Match a reality with a $3.5 million Pro Neighborhoods grant. This effort is leveraging public and private capital to make over $6 million of investment across 4 neighborhoods over 3 years. This is an innovative collaboration to fuel commercial corridor revival and entrepreneurship. The program is aligned with Milwaukee United footprint in the 4 corridors adjacent to the downtown: Historic King Drive, North Avenue and Fond du Lac, near West Side, and Cesar Chavez Drive. I'll now invite Beth Haskovic of LISC to share more about the success of Brew City Match. Beth?
Thank you, Ellen. Good afternoon, everybody. As Ellen mentioned, my name is Beth Haskovic. I'm the Program Officer for Commercial Corridor Revitalization at LISC. Thank you, Elmer. So I joined the team in 2018. We had an initial investment from JP Morgan Chase to pilot a program called Pop-Up MKE, and that was a way for all of our partners to get together and start to develop the collaboration and do all the background work that's necessary to have the trust and the systems in place to implement something like Brew City Match. So if you know me, you know that I always focus on the impact of the work we're doing. So most of my slide is photos of some of the businesses that we've been working with. In the upper right-hand corner, you see Lilo Allen and Tiffany Miller from the Bronzeville Collective. They were part of our pop-up initiative and are a destination business along in the Bronzeville neighborhood on Bell Phillips and North Avenue. And then we have Law from Elevated Healing and Wellness, who is operating a spa along Fond du Lac Avenue, and we're helping to Brew City Match to find a permanent location for her spa. And then in the lower right-hand corner, we have a business that is really flexed in relationship to COVID-19. Satonia Weston Roy won in the first round of Brew City Match for her business to open a Black-owned bookstore in the Bronzeville neighborhood. And because of COVID-19, she's taken her bookstore on the road with a book cart and is attending events in a socially distanced way to help build her brand as we work with her to get the financing in place to open her bookstore later this year or early 2021. So it's important to lead with those stories, but I also want to give you some stats on what we've been able to accomplish together. We really believe that data-driven research is important. So we helped kick off Brew City Match by investing in market analysis reports for the corridors. So we completed two, one for the North Avenue Fond du Lac plan in partnership with the City of Milwaukee's planning department, and then another for the Clark Square neighborhood where Cesar Chavez Drive is located. And we are working with Near West Side Partners and Historic King Drive bid number 8 in creating marketing sell sheets for those neighborhoods that build off of the market analyses that were already in place in those corridors. So we've just completed our second round of competition, and on Friday we launched our third round. And thus far we've worked with 80 businesses that have been selected in winners in one of the 4 tracks. So we help the business owners from idea to reality. So we have a business planning track where we partner with WIBIC to include the businesses in a long-term business planning course, so they can really understand their financials, their market niche, and understand what goes into, beyond just having a great product, what goes into building their business as a business owner. And then we have a space track where we work with business owners to secure a long-term permanent location for their business and provide support in filling vacant commercial storefronts along the corridor. And then we have a cash track, which is a combination of financing and mini grants that support marketing and design services for those businesses. So we've had 80 businesses who have received those resources thus far. And we also have 17 commercial properties in our pipeline that we're working with from pre-development through construction. And then we match the two and help fill some of those vacant storefronts with the businesses who have won in those other tracks. We've had additional investment made both through our collaborative partners, resulting in over 166,000 square feet of commercial property in the pipeline for redevelopment, as well as leveraging $1 million of the City of Milwaukee's White Box and Facade grants, and then over $2 million in private investment thus far. And I'll take the next slide, Elmer. And so here are some of the properties we've been working with. Two of the photos are the construction of the Legacy project, which will be the home for the African American Chamber of Commerce, but also a small business incubator, as well as Bob Lemke's building on Fond du Lac, where we converted 3 office spaces into retail spaces for the pop-up shop initiative. We did take a pivot during COVID-19 with support from JP Chase, the Greater Milwaukee Foundation, and the Zilber Family Foundation, as well as American Family Insurance, to create a $325,000 fund to support emergency response and recovery, which is essentially for a pivot from supporting startup businesses in these neighborhoods to really focusing on retaining existing businesses. And thus far, we've deployed about $100,000 between small business grants and 0% interest loans in our 4 neighborhoods. And we'll continue to build on that through recovery with supporting technology and equipment and revenue strategy building to make sure that we can retain those businesses as they begin to reopen. And then the next steps for the program, as I mentioned, we launched the 3rd round on July 10th. So we are really actively looking for both business owners and commercial property owners in our 4 neighborhoods to apply. The deadline's August 10th. We're beginning to work on a sustainability plan for the program to ensure that the program lasts beyond the initial investment from JP Chase. And we're beginning to also understand where are the pinpoints for policy change and systems change that we can begin to build off of now that we have the basic infrastructure and collaboration operating in a functional way. And then lastly, we're working to attract additional investment for the program. And with that, I will turn it back to Ellen.
I think it's actually going to come over to me now, Beth. Thanks for the overview. Really appreciate you diving deep into some of what's been happening with Brew City Match. From my own experience, it's been a tremendous effort to be a part of, and excited to continue to see the results unfold. For those of you that don't know, my name is Tony Pansera, and Elmer, you can go to the next slide. My name is Tony Pansera. I work for the Greater Milwaukee Committee, specifically on Milwaukee United. And I want to share a little bit more about another way that public-private partnership has been, and aligned investments have been making an impact through the effort of Milwaukee United. So the City of Milwaukee was directed by a number of the alders, including those that are here on the call with us today, to complete an anti-displacement plan outlining displacement dynamics occurring in our city and putting forth recommendations of how to prevent displacement from occurring. One of the recommendations of the anti-displacement plan was to assist existing homeowners in retaining their homes by identifying resources for low and moderate income homeowners in neighborhoods where rapidly rising values may create a property tax hardship. The maps here show footprints that share two characteristics. So they're both adjacent and proximate to the downtown. We've got Walker's Point on the left, and then a combination of a couple neighborhoods, Halyards Park, Brewers Hill, and the southern portion of Harambe on the right. They're both adjacent to the downtown, and they both saw property tax or property assessment increases of at least 10% over the city average. So 10% over the city average from 2014 to 2019. As a follow-up from this plan that the city put together and studying these dynamics, the alders and community members advocated to the Milwaukee United collaboration to coordinate with the city and community partners to launch an anti-displacement fund specific to these geographies. We pulled heavily from the only other model out there that is of similar focus in Atlanta, as Ellen mentioned, to create a framework for local implementation. Our executive committee worked to raise commitments of $400,000 for a 5-year pilot in relatively short order this fall to enable us to launch in November of 2019. And a quick shout out to some of the funders who've committed resources and enabled us to get that pilot launch, including a number of GMC members, American Family Insurance, Bader Philanthropies, the Bucks Foundation, the Greater Milwaukee Foundation, Taylor Slater, Cole Philanthropies, the Medical College of Wisconsin, Rinka, and Zilber Foundation. So the criteria for the program was relatively straightforward. We wanted to make sure it was simple and easy for folks to enroll. So they have to have the owner-occupied homes. They have to have a longevity of ownership beyond when these dynamics started occurring. They have to be up to date on taxes and not subject to foreclosure, so that the investment from this fund and program will be sustained, and they have to be at or below the city average income. So the fund, it operates by paying the balance over a household's tax bill from the 2018 tax year during the 5-year pilot period, so that the rising assessments are supported out of the fund, and the family has some relief from those increases in values that are occurring. Through implementation this year, we worked with Riverworks, Development Corporation, Southside Organizing Center, WestCare, the Milwaukee Urban League, and a number of other community partners to get the word out, to have info sessions, and to get folks enrolled in the program. Next slide, please. So what were our results from this first year? Reminding you, this started in late 2019. We had 111 folks eligible through the application. 86 of those actually received benefit from the program this year. The gap between those two is folks that didn't see an increase in their taxes. And among those 86, the fund provided almost $40,000 in tax assistance payments, with an average of $446 each household. I would say that the range was pretty significant there. We had families that were receiving as little as $18 and families as much as $1,800. So if you can imagine living below the city average income and having a almost $2,000 increase to your tax bill, it's pretty staggering. In terms of demographics, 100% were below city average income. For homeowners who supplied their race and ethnicity, 74% were African American or Latinx, 56% were 62% or older, and many of those folks were fixed income too, so perhaps less adaptable to changing market circumstances based on increased earnings. And the median household income was just shy of $22,000. So even though we set the requirement for the program for a 5-year ownership period, we found participants had owned their homes for an average of 22 years. So I think that was a real success from our end in terms of wanting to support, as one of the goals from this pilot, long-term homeowners who have been a part of the community and the fabric of those neighborhoods. And we far surpassed that 5-year threshold that we set. But that also, I think, is an indicator of those folks. The folks that have been there for a long time are the ones that are hard pressed to meet the changing circumstances of the market. And now we're working on the administrative side, preparing for next year's enrollment and application process, getting more folks enrolled and recertifying those who received benefits this year, and also working on developing more sustainable funding models to be able to sustain the fund beyond the 5-year pilot period and a long-term commitment to the neighborhood. This is just another tangible example of how public-private partnership and the sectors working together can slow the impact of displacement, and particularly in communities of color, and how partnership can make an impact in the short term. I'm happy to share more detail with anyone interested, but for now, we'll keep moving in the program and I'll pass it back over to David. I think you're still muted, David.
Thank you, Tony, and thank you, Ellen, Greg, and Beth, for the description of these programs and the insight into the nature and the success of the collaboration. As mentioned, the City of Milwaukee has been an important piece of the collaboration, with much support from Alderwoman Malele Coggs from the 6th District, Alderman Jose Perez from the 12th District, and Alderman Russell Stamper from the 15th District. Today, we will hear from these alder people on Milwaukee United, and specifically Brew City Match and the Anti-Displacement Fund, and how they've contributed to the growth and access to resources for residents and businesses in their districts. We also welcome Dr. Eve Hall, President and CEO of the Milwaukee Urban League, who will moderate the conversation among the alder people. So Dr. Hall, let me turn it over to you.
All right, now you should hear me.
Yes.
Okay, correct. Thank you. So, welcome the 3 individuals that are on today: Alderwoman Malele Coggs, Alderman Jose Perez, Alderman Russell Stamper. I know personally that they are committed to economic equity, quite frankly, because that's really at the center of everything that we're talking about. And what I've always believed, and I know all of us know, is that ownership, whether it's your home, whether it's a business, that is really the great equalizer in this society. So thank you 3 for joining us. So let me, I want to go straight to direct questions, and then I'll go back to just some general things for all of you to answer. So let me just start with you, Alderwoman Coggs. Can you speak to the impact of this anti-displacement fund that Tony was just talking about? I know you've been in conversations with us about this, and just some of the other anti-displacement strategies that you and the council are working on, including, I believe, a citizens task force.
Yes, thank you. When you talk about the impact of the anti-displacement fund, I think the greatest impact is for you know, some residents, it has been the difference between them being able to stay in the homes that many of them built, that many of them have had in their families for a couple of generations now, and that they've invested in over several years. And for others, it helped to make the ability to keep their home a little longer possible as well. So without it, maybe they wouldn't have lost their house this year, but they would have been on the road to do so had they not gotten the support for the fund. So the biggest difference that it's made is for particularly, because if you look at the average age of those who were able to receive the funds, they are seniors, most of which are on fixed incomes. For many of them, it's just an ability to keep that family house within the family longer. So it makes a difference. As far as our other efforts, you know, when we thought about over the last several years, myself, Alderman Stanford, and Alderman Perez, the impact that the investments we knew that were coming to the downtown area, the billions of dollars we knew that would be invested over the next, you know, decade or so, the impact that that would likely have on those residents who lived in and around that area, we began to think about what could be done. So our early on conversations with MKE United was, what are we going to do about displacement? So we did legislation to make the city do a study on a displacement. Out of that study came several recommendations, looking at what they do across the country and just some ideas of what we could do here based on state law, based on ordinances and that kind of thing. One of those things, of course, was the Displacement Fund, which we were able to launch last year. Another was legislation that myself, Alderman Perez, and Alderman Stanford passed about a year ago, which requires that the multi-unit developments that are created within those areas on the mapping that everybody saw earlier that we knew would be impacted by displacement, have to have at least 20% of the units within them kept affordable. We think about homeowners often, and that's what the displacement fund is for, but displacement is not just for the homeowners, it oftentimes is for the renters as well. So that is one piece of legislation we've been able to pass through to help renters. One of the other things we did as we went through this process is we heard from a lot of residents who said, hey, this is affecting us, we want some say-so in it. As a result, we created the Citizen Anti-Displacement Advisory Committee, so that any legislation we create to impact displacement, that they are able to vet it, see it, give us advice on it, and that there may be some residential ideas that we wouldn't have thought of that hopefully come out as recommendations from the Citizen Advisory Board as well. The Citizen Advisory Board the members have been selected, and they should be having their first meeting before the end of this month.
Great, thank you. So Alderman Perez, can you speak to the impact of just the economic growth that's going on in your district, and how has the Anti-Displacement Fund and Brew City really helped with economic inclusion?
Well, I just want to say thank you to everyone involved on MKE United. Whether you're a staff member, an executive director, you help fund the Anti-Displacement Fund. It's made a difference, as Alderwoman Coggs has mentioned, but you know, we want to show your gratitude, and for us in the district, it's meant a sign of hope that we have the private sector working with our local electeds, and that they're paying attention to the environment around us. And so when you talk about the growth on the south side, you know, many people are proud of the development and the apartment units created, and we have in those developments we have several that are LIHTC deals, that are affordable housing, and we're very appreciative of that. But everyone living near it feels like there's this dragon breathing down their throat, and that it's just coming further south and further west, and that their neighborhoods will change. And so having this dialogue and having trusted partners in our community, it is so important that the right people are asking the questions, spending time to listen to them, and also deliver the message that we're in this together. And so and I'm very proud that of all the shiny buildings in Walker's Point, not one property has been either raised or demolished that was a residential unit. And even with that, we haven't displaced anyone in all of Walker's Point. There's been abandoned warehouses, parking lots, but the residents nearby are wondering how are we working with them, and we have the great divider of the highway there, which once you go west of I-94, the socioeconomic and demographics change dramatically. And for us, when we look at what it's meant to the neighborhood, people are happy and engaged, and we need to continue on that path. With the Brew City Match, we've had lots of excitement coming back to Cesar Chavez through the Brew City Match, creating opportunities for entrepreneurs to get started, to feel like we have a space that people can come visit. We have a product. We have help with marketing, with a business plan. And for the street, it's meant that we're taking some of these vacant parcels and providing entrepreneurs an opportunity to launch from there. And I will tell you that we need more of that, and we need more of the outreach, because so many folks are benefiting from that. I think we're very hesitant at the beginning that someone wanted to help, or that Brew City Match seemed too good to be true. So on Cesar Chavez has had a huge impact as you look at the development of business and the potential of some of these storefronts becoming permanent spaces also, not only for reoccurring businesses, but other businesses to make their permanent home.
Okay. Thank you, Alderman Perez. And now you, Alderman Stamper, we know that opportunity zones have been really important to you. Can you speak to their importance in terms of economic development in the Central City, as well as entrepreneurial support? Oh, turn your mic on. There you go. You turned it back off. There you are.
Thank you. Right. Thank you, E. Thank you, Milwaukee United, and thank you, GMC. I'm happy to be here. So yes, opportunity zones I had high hopes for, and I still do if we can get the interest to invest into the Central City. So they would be wonderful if they were actually working. I see wealthy individuals not taking the interest like it should in the Central City, and what I'm finding out is they're more comfortable in investing in so-called safer communities. So what I would like to see happen, and we discussed this multiple times, is an economic development fund, and we can use the same model as with the opportunity zone language and just develop a opportunity zone fund for opportunity zone areas in the city, where we have local capital matched with the city, successful TIF funds, and the business community all investing into an area with a fund for local entrepreneurs and to attract local African-American developers who know the city and who are committed to building up the Central City. So an economic development fund strictly for an opportunity zone area. So that's what I'm finding, and I think we can do it with the current funding that's available with CBDG. I think that'll be a good way to start off the funds and get some matching with some of the business community. So I do love the Brew City Match. It has been successful along Fond du Lac in the 15th Automatic District. I like to see that grow. And I also like to see us strengthen our partnership with Milwaukee United and the GNC. What I always remember that what's unique about Milwaukee, and I got this from the leader of the Kresge Foundation when Julia and the rest of us went down to Las Vegas. What they was always stuck in my mind when they came back to present to a bunch of us in Milwaukee was that Milwaukee is unique based on our public and private partnerships. No other city has the strength like we do. So we have to not take that for granted and realize what we have in this partnership and start using it to a better degree. So we need a fund strictly for the Central City so we can catalyze more opportunity within the Central City. Thank you.
Okay, thank you, Alderman Stamper. And now here's a question for any or all of you to answer. And that is, how are the residents in your district impacted by the pandemic and this whole economic downturn? When you just kind of look at it from a broader view, what are you seeing and what are you thinking in terms of how we all have to move forward?
I'll tell you, as the numbers tell you, the Latinx community is being hit hard by COVID. And, you know, I represent a district where so many people are in the essential workforce and cannot do their work from home and are forced to go to work. And then, you know, we know that we have several generations living in one household in the Latino community. We also have a very high density of young people in our neighborhood. And we are seeing folks struggling with food, and we're seeing small businesses having a hard time taking advantage of the government resources that are out there, whether it's the PPP or everything else. Some of these programs were launched, and for the small business person who has issues with their back office and paperwork, this became a very daunting task. And so as we made several referrals. We were constantly trying to get people all the help. Nathaniel Martinez from DCD was very helpful in the neighborhood outreach team, business outreach team. But the resources that were available were scarce and hard to come by on the business side. And we're still continuing to make referrals for some of the food pantries in the neighborhood for our undocumented immigrant population. To make sure they're going to places they feel safe to get food and help.
Okay, thank you. Others?
Yes, well, it has affected the Central City horribly. What it has done is expose the negative conditions of the most vulnerable and at risk. As you can see, we need more and more health resources and access to help for health. So if it wasn't, I'll have to give a lot of credit and gratitude and appreciation to the community-based organizations, because they have been the ones who have stepped up in the Black community to help out the individuals who need it the most. They're having weekly and monthly pop-ups, PPE giveaways, food giveaways, toiletry giveaways. I participated in a few of them. But in the health department, OVP have been wonderful too. But if it wasn't for the community-based organizations and the programs that are grassroots, we would be in a lot more trouble than we are. So the awareness and the ability to get what they need have been crucial in us surviving during this pandemic. But as you can see, we have to put way more focus and resources on the health of the conditions of the people who are the most vulnerable and are most at risk.
Yes. Thank you. Alderwoman Cox, did you want to add?
Yeah, I echo the sentiments of both of my colleagues. The access to testing was extremely limited in communities of color. I do think now, access to testing sites and testing sites with all of the requirements of referrals and symptoms and all of that are more readily available. So I do think people are more generally getting tested than they were in our communities previously. But I think early on, that was a huge problem. Early on, I think access to PPE for communities of colors was also very limited. I do think now, similar to what Alderman Stamper said, there is more accessibility. I know today at our council meeting at 1:30, one of the pieces of legislation being led by Alderwoman Dimitrievich is for the health department to create more access to masks as we look at potentially doing an ordinance that requires masks. I think also, we've all seen the headlines of the amount of evictions that are occurring as a result of people not being able to pay their rent during this time, with so many businesses at a state of not being able to be fully open. A lot of people that we represent have not been employed. It's kind of weird. It's like some It's a lot who have been essential workers, so their health is at risk on a daily basis just with them having the jobs they have. And then it's a lot who lost their jobs because of the challenges that businesses have faced. So dealing with those evictions as they make their way through court and the potential homelessness or necessity for to help find homes for some of these people is going to be a huge challenge I think this community has to face. Also, I think the pandemic exposed the technology divide, whether it's having to homeschool your children and doing virtual things, or whether it's having to work from home. For those of us who have the ability to, there is a assumption that both you have access to the technology equipment and also the broadband necessary to connect with the internet. And many of the people that each of us represent do not. So recognizing that what once was a luxury for people is now like a utility. Is something that I think we also have to deal with as a community. And then there's a couple other things. One, I know I'm a mother of an 11-year-old and a 5-year-old. An 11-year-old who didn't get to go to her 5th grade graduation, a 5-year-old who misses all of his friends, and having to be on lockdown for a few months, and just the mental state of and also dealing with a nation full of unrest and a city that is also participating in that unrest. I think that the economic healing is one thing, but it is a mental and emotional healing that this city, this nation is gonna have to go through after stores open up, after schools start back, and all of that we really are gonna have to pay attention to, from our children to us as adults. I think we're used to being a communal people, but then having to go from, staying away from each other and wearing masks and all of this kind of thing, and then getting back to what people think is normal, I think it's not gonna be an easy thing, and we need to be prepared for the challenges that come from that. And lastly is this, what's next? One day as we're going to open up, the next day as we spiked higher numbers, as we've heard here today on this call, than the state has ever seen. Is other states who opened up who are not closing back down because of the outbreak. It's is there an end in sight? And what's next? And us being policy leaders, but not medical experts, and trying to help manage those expectations with the public is something that I think is something we all have to put our minds around and think about as we move forward.
Thank you. Well, Alderwoman Cox, Alderman Perez, Alderman Stamper, just thank you for your comments and your insights, and just for the work that you keep doing. And we need you. I am glad that we are partnering with you both, as MKE United, and just the work I know we've done through the Milwaukee Urban League. But the last piece that you touched on, Alderwoman Cox, I think is something for us to really grapple with around the mental and emotional health of our communities, because it is huge. And we just had a roundtable that included young people. And I will not forget where one of them said, they just don't even know what to think. They don't know how to think right now. And, and just the perplexity and the complexity of what they are dealing with in their homes and the community, to your point. So, when we talk about next steps, that does have to be part of our next steps, since around that mental health and emotional well-being of our young people and all of our families in our city. So with that, thank you. I will turn this back over to David Lubar.
Dr. Hall, thank you for moderating today's panel. I'd also like to add my thanks to the Alder people for your leadership in our community, and particularly in your districts. The history of disinvestment cannot be changed overnight, and we have heard how much needs to be done, from mental health to healthcare to employment to education to housing and more. And we've heard about various programs today. They are small steps. Thankfully, they are steps in the right direction, and thankfully the programs are working and creates a platform or a basis to build upon. Our goal is an equitable Milwaukee, and the GMC and its many partners and members are committed to achieving impactful change going forward. So we know, as they say, it takes a community. We all need to work together. And thank you again for your leadership and for working with the GMC. As a final reminder to the members of the GMC, please complete the racial equity pulse check survey that Julia just had sent to you. And this then concludes this meeting.
Mr. Lubar.
Thank you. Thank you.
Mr. Lubar.
Yes.
Hey, just in the interest of helping the alderman out today with a big vote, did Dr. Raymond or the medical college have a position on mandating masks? What is their position on mandating the mask? Won't you help us out today, man? We've been bombarded with emails, so I don't remember coming across Dr. Raymond. What does he think? Thank you very much.
Let me just say the evidence shows that if you mandate mask wearing, compliance goes up. On the other hand, people that are making policy need to understand there may be legal challenges and that the environment between our communities and law enforcement isn't optimal right now. And you have to balance their willingness to either educate or enforce and the possibility that the friction between our communities and the law enforcement might get worse because of a mandate. So I don't envy you for having to try to balance those two sides of the equation.
Good answer. I think you made it harder. Thank you very much.
Dr. Raymond's, if you look at the system behind Dr. Raymond, it speaks volumes as to where our institution sits. So
I think the facts show if you're a Republican or a Democrat or a conservative or a liberal, if you wear a mask, it'll be better for our country. So we're all going on mute now, and that's the end of the program. Thank you.
Thanks, David.